One of our jewels is our primary care program, which occurs at our Woodbine Clinic, which is just about a mile or so down the road. It's a state-of-the-art, brand new facility where residents see and care for about 14,000 children. In addition, we run an urgent care clinic out of that facility as well that our residents help staff. And then in the hospital setting, our residents work in both the general pediatric wards as well as our neonatal intensive care unit, which is the receiving point for most high-risk infants in the region, as well as our critical care ICU. And then there's a whole host of subspecialty clinics that are on our campus that the residents rotate through as well. Our patients are very complex. We are a very large referral center for pediatrics in our region. There actually isn't a pediatric facility like this, a tertiary care children's hospital, for 100, 150 miles in any direction. And so patients come here primarily from all over northeastern Pennsylvania, central Pennsylvania, and the southern tier of New York. So it's a very large area. And so these patients who come to us very frequently have complex medical needs that really require intimate connection between all of the providers that they have. We are a unified pediatric field, and that includes not just the pediatricians and the pediatric subspecialists, but a whole host of pediatric subspecialty surgeons, general pediatric surgeons, pediatric radiologists, pediatric interventional radiology, and so forth. So we're all collaborating and working to care for children together. We have a fellowship acceptance rate of 100% during the entirety of the residency. So we've never not had a resident who was interested in obtaining a fellowship training position not get one in the history of our program. So I think our outcomes are exceptional. We're fortunate to have folks really representing every specialty in pediatrics, adolescent medicine, genetics, cardiology, pediatric critical care, child abuse, you name it. We're really very, very fortunate as a residency program to be able to have our residents work with all of these people. Obviously, we're a very broad program and we have everything that one would need to be well prepared for a career in pediatrics. And we have a great health system that can teach people not just how to care for a patient locally, but how to integrate them through an entire health system and to make sure that those people get the best of care in a high technology system.